Hi class, so we left off here with recommended nitrous oxide exposure levels. The National Institute of Occupational Safety and Health recommends no more than 50 parts per million as the maximum exposure limit for dental personnel. In operating rooms in the U.S., it's 25 parts per million. And various countries, it is different. So there has been no consensus reached on occupational exposure levels. You want to know as an employee, as a practitioner, is it safe? To date, no direct evidence exists of any causal relationship between chronic low-level exposure to nitrous oxide and potential biologic effects. So, having said that, every attempt should be made to reduce the level of trace nitrous in your office, and we'll talk about that. But let's talk about some of these specific biologic issues that have been connected to nitrous oxide, some specific health concerns. Nitrous oxide has been connected with the inactivation of the enzyme methionine synthetase. This is an enzyme needed it's linked to B12 metabolism needed for red blood cell production and DNA synthesis. The issues were when someone is exposed to 80% of nitrous oxide for 15 minutes. We are not using 80% of nitrous oxide in our offices. Reproductive health, as you know, we're recommending that no nitrous oxide be delivered in the first trimester, but no evidence exists that there is a direct causal relationship between reproductive health or miscarriage and scavenged low level of nitrous oxide. It was animal studies so rats who had 60% nitrous oxide for 24 hours produced miscarriage. So we have to look closely at the studies. Megaloblastic anemia back in the 50s, tetanus patients were treated, some tetanus patients were treated with nitrous oxide and developed megaloblastic anemia. That's no longer the case. Here's something that a biologic issue, health issue that you should be aware of, and it's neurologic disorders with chronic abusers. So individuals who are abusing nitrous oxide in a chronic way. They will experience tingling and numbness in their arms and legs, in the extremities, weakness, lack of coordination, lack of strength in their hands, a lack of dexterity in their hands, and a slowed walk. So for you, let's say you are going to become a pregnant dental professional, what do? You should know the exposure levels of nitrous oxide in your environment. And of course, you will use, and your office will use, all recommended trace gas scavenging systems. And it'll be up to you and your physician to determine whether to avoid being in an operatory with nitrous oxide being delivered during your first trimester. Speak to your physician. This is what we're going to do. We're going to scavenge trace amounts of nitrous oxide gas. Scavenging, we use a scavenging mask nasal hood combination. And of course, this doesn't completely prevent gas from being eliminated, right? Because it is also eliminated through the patient's mouth. So not just their nose, but their mouth. So we want to minimize, to keep you healthy, minimize the trace amounts of gas before, during, and after patient administration. Well, I suppose not after, because it's done, but before and during patient administration. That's limit conversation. We don't want the patient talking during nitrous oxide administration. A scavenging mask system is standard and standard of care. So because the nitrous oxide is exhaled through the nose and then vacuum, the HVE transports this gas outside through the central suction system. The optimal evacuation flow rate, so the optimal flow rate for the HVE is 45 liters per minute. An evacuation flow rate that is higher would kind of produce excess suction and make that nitrous gas unavailable for patient sedation. Less than that would be cause gas contamination, right? We'd be having excess gas come out and not be sent through the vacuum. So optimal evacuation flow rate, 45 liters per minute. So how do we find out how much nitrous is in the ambient air and around you? Infrared spectrophotometry is a gas analyzer, can detect the levels of nitrous oxide in the ambient air. This is the most effective and accurate method to determine nitrous oxide and can detect minute levels of gas, lower than 1 part per million. These are used, though, in surgical suites, operating rooms, where a baseline number is established and then checked periodically. The air is checked periodically. You might see in a dental office a dosimetry badge. These are similar to your radiation dosimetry badges, where you wear this badge for a recommended period of time, sent back to the manufacturer for analysis, and it determines kind of how much nitrous oxide you're exposed to. For a nitrous oxide dosimetry badge, you place it in the breathing zone, in other words, in the area of the nose and mouth. They're great for dental practices. They are not expensive. And so if you're not using nitrous oxide frequently, it's really quite nice. What's the disadvantage? It's not, the infrared gas spectrophotometer. This can't detect minute levels of gas. So ambient gas, what we're trying to keep out of our environment. The biggest source of ambient gas is patient talking and patient mouth breathing. We've got to encourage them to breathe through their nose, take deep breaths through their nose. An ill-fitting nasal hood or mask, not titrating, providing too much nitrous oxide to the patient. Patient movement, can't sit still, and so the nasal hood, we get some leakage around that. Lots of connections on the unit to be checked. Those might be loose, conduction tubing that's leaking or cracked, door seals, so a door that doesn't seal all the way. Any place where re-entry of contaminated air can occur is a source of ambient gas. So to minimize your occupational exposure, number one, you want an effective scavenging system, a properly fitting and scavenging nasal hood. Again, scavenging nasal hoods are standard of care, and the evacuation flow rate at 45 liters per minute. I'll show you what that looks like this week when you're in clinic. You're going to, of course, establish appropriate tidal volume and titrate the dose. We're going to ask the patient not to talk, right? The most common cause of nitrous contamination in the operatory is patient talking and mouth breathing. Certainly, equipment should be maintained, connections checked, make sure there aren't any cracks or leakage areas. The flow meter should be calibrated every 2 years. At the end of the day, we want to make sure all the equipment is shut off and secured. Just improve general air quality in the office. Fresh air, use fans. A non-recycling air conditioning system, generally that won't be something, a recycling air conditioning system is something used in high-rise buildings. So unless you're in a skyscraper or a high-rise building, that's not going to be something you deal with. Open the windows every once in a while. And of course, you want to make sure your vent is scavenged outside, away from the building, and away from intake air vents. And of course, we're going to educate our staff. Periodic office education is important too. Nitrous oxide is a drug and therefore can be used for recreational purposes. We're on to chapter 17. It's been used for recreational purposes since the 18th century. Just a kind of a definition of what an inhalant is. So not all drugs that can be abused through inhalation are classified as inhalants. Inhalants are substances that are characterized. These are substances that are rarely, if ever, taken by any other route other than inhalation, right? So nitrous oxide is an inhalant. It can't be taken any other way than by inhalation. Many inhalants are central nervous system depressants. Think about nitrous oxide. But inhaled chemicals are absorbed rapidly into the bloodstream, right? And through the lungs, quickly distributed to the brain. Any number of ways. Inhalants are used snorting from containers, spraying something directly into the nose or mouth, things called bagging or huffing, balloons, putting the inhalant in a balloon and then inhaling that. So within seconds of inhaling these chemicals, the user is going to feel drunk, intoxicated, with other effects similar to those produced by alcohol. But inhalation intoxication lasts only a few minutes. And so abusers are prolonging their high by inhaling repeatedly over several hours. Inhalants are separated into 4 categories: volatile solvents, aerosols, nitrites, and gases. Volatile solvents and aerosols are legally sold products, easy to come by, inexpensive, like paint, paint thinner, hairspray, shoe polish, nail polish remover. All of those are volatile solvents and aerosols. Nitrites are inhalants that actually dilate blood vessels and are muscle relaxants. And then, of course, gases. Nitrous oxide is easy to obtain. It's approved by the Food and Drug Administration as a food ingredient because it's used as a whipped cream propellant. Nitrous oxide comes in little 3-inch long containers called whippets. Whippets hold approximately 4 to 5 liters of 100% nitrous oxide. So one of these little 3-inch containers is 100% nitrous oxide. And it's used as a whipped cream propellant in the restaurant industry. Nitrous oxide abusers, if we're not talking about teenagers inhaling solvents and aerosols, or, people that are working at the coffee shop or restaurants using whippets. Nitrous oxide gas abusers are generally older. They tend to be healthcare personnel. Now, healthcare personnel have access to a number of drugs, to many drugs. So generally, their drug abuse is not limited to only one drug. Anesthesiologists, students in psychiatric and maxillofacial programs, physicians, and dentists are your most likely to be your drug users in healthcare. I'm going to stop here. We'll come back to overexposure, what might happen when you are overexposed, and then we'll be wrapping things up.